Dr. Satyajit Kumar Singh, MS FRCS. I am a senior consultant urologist and managing director of Ruban Memorial Hospital, Patna. Healthcare compared to other part of the country, I wouldn't say very satisfactory on the both level, primary health as well as tertiary healthcare, which is technology based, investigative facilities. It's been low. In last 10 years, things has improved on the primary level. So I feel there is a big void, and a lot of patients, those who can afford, are flying to big cities for the treatment. That gives them disruption in their family life, cost of the treatment, and the emotional stress of being away from the home to get the treatment. So we feel the more and more high technology hospital should come, whether it's in the government sector or in the private sector. There are many challenges. One, that we need to bring confidence in the people that we can perform the same sort of treatment and can give the same technology which is available in big cities. Other is the affordability, because every technology costs money, and it's a known fact that the income, per capita income of Bihar is low. So that's another challenge. And the third challenge is non-availability of trained nurses and technicians, and even younger generation doctors who are not very willing to come to Patna. So these are challenges in establishing a high technology hospital in Bihar. Unfortunately, it's not good. People are not aware of what they need to have as a preventive care, preventive medicines. Even if it is available, many places it is not available. The system is not working. There are efforts to bring it to the level, and it has improved, but is still far below other part of the country. Tertiary technology has got a lot of problem because of the affordability as it is here, and the trained persons, and other infrastructure which needs to establish high technology hospital is not at the moment available in the rural part of the Bihar. I was born in Patna, trained in Patna, been abroad for over 17 years. So coming back to Patna was more of my emotional reasons, my family commitment, my commitment to the society. At the same time, I think as an entrepreneur, one look, if you have got resources, if you got talent, you look for the place which has got potentially more use of your talent and your resources. And in that way, being native, I felt this is the best place for me to come and establish what I wanted to do it, and I have done it, and I am satisfied that my vision was right and I have succeeded in doing what I wanted to do it. Is because Patna needed what I have delivered. Same thing, there is a problem of affordability, the problem of getting trained people here. At the same time, patients' confidence, those who can afford it, they feel that good things can be only done in the bigger cities, in metro, in corporate hospitals. But I had to convince, and I managed to large extent, that same thing can be done here, and the treatment is always one good treatment. There is no different treatment for any other country or other cities. Technology is the same, is a matter of cost. So with the number of patients, we can afford to do the same technology, give the same type of materials in the treatment, and same standard treatment as a lesser cost, at the affordable cost. And that has been biggest challenge for me to do it, to maintain the standard and technology and make it affordable to the people of Bihar. We are using technology in surgery, which is minimum invasive surgery, even non-invasive method of treating stones. We are using all sorts of cardiac cases here, whether it's a angioplasty or pacemaker or giving ablating the arrhythmias. We are doing also knee and hip total replacement apart from the trauma, and we are thinking of starting transplants. These are technologies which we have managed to perform in last 20 years gradually. We have built up team, and there are patients who need it and they are coming for it. So we are preventing patients going out, and the money which would have gone out in other cities is being used here in Bihar itself, creating employment as well as patients' cost of treatment has come down because it is being done locally. As I told you, I came for emotional reason, and that emotion came from my family, and my family has been always in public activity and the political and social platform. That has inspired me, and that has given me a test of confidence and love of the people. And at the same time, there was a need for the persons like me and technology which we together providing here. So that's the reason I'm here. Now, apart from making as a practitioner, I have done neurology, but I have built up a team of different specialty. My doctors has contributed in building this hospital, not only by professional skill, but they have also given helping hand in finances as well, and they have worked for months together without getting any full enumerations, and hospital have earned and paid them back. So this is in fact a cooperative hospital. Ruban Memorial Hospital is a cooperative hospital, and that is what I have made it. Further, apart from the surgical medical side, I am also involved in the social platform, socio-medical platform. I'm involved in doing a lot of health awareness camps. I don't believe in providing tablets in the health camp, but I provide a lot of health checkup and awareness of how to get a good treatment. Apart from that, I'm also president of Indian Doctors on Peace and Development, which is affiliated with the international organization based in Boston, America. It's called International Physician for Prevention of Nuclear War. It was started during the thick of the Cold War by the Russian and American doctors. It works for the peace in the world, anti-nuclear war campaign, and I'm involved in teaching medical students, paramedics, their commitment to the society and how peace can be achieved through the health in the country, in subcontinent and the world over. So that is my way of working here in my medical profession and the social life. The moment you charge the patient, there is a bit of doubt in the patient's mind. So you have to have a very good counseling skill, and you should counsel them and be very transparent and make everything very apparent to the patients, that why they are having treatment, why they are having surgery, and what is the charge, and how it can happen in other part of the country and other places comparatively of same treatment. So it needs effort on the part of doctor to establish confidence in the patient. At the same time, I think there are good and bad people in all the professions, maybe in our profession also. So you have to be distinct to yourself by making it very apparent, and it should be evidence-based medicine. If you go by the evidence-based medicine, means you prescribe drugs which is actually needed and you convince a patient that they need this medicine. You follow proper international protocol for indications for the surgery, and you make the patient aware of the protocol and why you are doing it. That will take care of the patient-doctor's relationship, and ethics has to be done. And I also advocate that our professional body should have a governing and supervisory role in looking different hospitals, different practitioners' ethics, monitor it wherever there is any deficiency. Our professional body should knock them remind them, and they make them straight on the line of ethics to save the good relation of the patient and the doctors. I see to develop this hospital, as I said, I started with 3 beds with the modern kidney stone treatment clinic in 96 November, which expanded to 40 bedded hospital in Gandhi Maidan, and now we have got 200 bedded hospital. So I am very fortunate that my hard work and my transparency and my ethical attitude and people's confidence has brought me in 20 years from 3 bed to 200 bedded hospital, and I want to go further than this, where we have a better facilities, bigger hospital with the school of paramedics. At the same time, we believe in spoke and wheel concept in giving private health care, where we plan to have some peripheral clinics where OPD can be done, the primary emergency treatment can be done, and community health care involves child and maternity care, immunization, prenatal investigation and treatment of the pregnant women, and the facilities for the delivery of the child. So these are my future plan, that we should have it in the different locality. For the base hospital, once we become more successful and bigger in number, we want to bring every technology. My mission is that Patna should be at the dot for all the technology. Today we are doing all the laparoscopic surgery, we are doing arthroplasty, we are doing cardiac work. Future is more advanced laparoscopic surgery, robotic surgery, and it's my mission, it's my intention that in the future, once people become affordable, the prices come down to the robotics, we can bring more technology. At the same time, we get involved in private sector in primary health in the community, where we can subsidize the treatment, we can do free health checkup, health immunization for the children. So these are my future plans.